Well, thank you, all of you, for attending this webinar this day, the 26th of March, 2020. A very special time for the world, as we are facing a pandemic we have not seen in our time. And we are particularly here to discuss what is the role of the churches and the faith communities, and how can we also contribute in this situation. I welcome many who have a lot to contribute to this conversation, and I'm sure this will be a very meaningful way of sharing, but also of discussing these questions together. I'm also quite convinced that this is a unique opportunity both for us to meet as persons, but also representing very different communities around the world. So the first I would like to ask is that you present yourself, but also where are you sitting? Who are you, and what are you also representing as a community in this conversation? So first I invite Dr. Mathews George.
I am Mathews George, General Secretary of the Christian Conference of Asia. I am based now in Chiang Mai in Thailand.
Thank you, welcome.
Thank you.
And Mrs. Sarah Hess.
Hello, my name is Sarah Hess and I work for the World Health Organization. I'm based in Geneva and I'm actually on campus in Geneva at the moment, although most of my colleagues are teleworking in some way or another. So I'm very happy to be here.
And welcome, we are very happy that you could join us. Reverend Dr. Hyun Bae.
Hello, my name is Hyunju Bae. I'm based in the Republic of Korea. I'm a New Testament scholar, and currently I am a Vice Director of Research Center for Korean Church. I serve on the Executive Committee of the WCC, representing the Presbyterian Church of Korea. Thank you.
Welcome. We have Archbishop Job of Telmessos.
Hello, I am Archbishop Job of Telmessos. I'm the permanent representative of the Ecumenical Patriarchate of Constantinople to the World Council of Churches. And at the moment, I am confined in Paris.
Welcome. Thank you for joining us. And Mrs. Ebun James.
I am Mrs. Ebun James Dickham, and I am the General Secretary for the Council of Churches in Sierra Leone.
Welcome. Thank you for joining us.
Yeah, thank you.
And we have Dr. Olivia Wilkinson.
Dr. Olivia Wilkinson, I am the Director of Research at the Joint Learning Initiative on Faith and Local Communities. I am currently in Washington, DC. Thank you.
Dr. Katherine Marshall.
I'm Katherine Marshall. I'm sitting in Washington, D.C., where I'm a professor at Georgetown University. I also lead the World Faiths Development Dialogue, which is working to build bridges between religious and non-religious communities around issues of development. And the main reason I'm here is that we have launched an effort to track what faith communities are doing during this crisis and to try to bring the voices together and to track the trends.
Thank you. Welcome. Dr. Mwai Makoka.
Thank you. I'm Mwai Makoka. I'm Program Executive for Health and Healing with the World Council of Churches. I'm based in Geneva.
Welcome, and thank you for joining us, Mwai.
Thank you.
Let me, as a word of welcome, share with you a few reflections. Around the world, this time, with this COVID-19 pandemic, surely tests our systems of governance, of public health, but also our leadership and our solidarity. And as people of faith, we stand with and believe in the God of life, the source of all existence, life and health. And we pledged our very effort to protect and to safeguard life, to promote health, to raise the prospects of the sick, of the vulnerable, the marginalized, the poor, the elderly. This is what we are called to be. And this is also what we want to do. And that's why we are here. Facilitated by our World Council of Churches staff, we are grateful to be able today to convene church people from around the globe to confer about this pandemic and to learn from our partners of the World Health Organization about the picture as it stands now, and to hear other advices and strong voices that can help us to address these issues, to help us to see how we can be stronger in our prevention, containment, and suppression of the virus. We're also very grateful for the concrete signs of collaboration among churches and with governments and international organizations, especially the WHO, at this time of peril. We know that as communities on the ground with deep roots in the cultures and in the traditions of our people, churches and other communities of faith have a unique mediating role to play in this crisis. But we also believe we have a role to keep people well informed. And therefore, a myriad of questions arises at the nexus of communities of faith and the public good, and we hope to explore and address them here. So in Africa, in Asia, Europe, North America, or elsewhere, each local presents distinctive challenges for the Church's mission and for the healing presence we can have, even apart from the medical assets that many churches have to offer themselves in this situation. So many of these challenges are cultural, they are personal, they are economic, they are religious, they are spiritual. And we hope today to hear of the best practices as they are emerging in specific regional and confessional contexts. We also note that the special challenge to healthcare professionals, to local and state authorities, to endangered populations, particularly migrants and refugees, the elderly, poor, and those who work daily to expose them to possible infection. These are the realities we explore here today, and I'm grateful to our participants and to our experts and leaders from all sectors who are taking this time today to share their experience and insights with us, to enlighten and also to encourage us in this unparalleled situation, and to offer a word of hope for all people. Welcome to all of you. We then have the privilege to go into the first round of conversation, where I will first ask that we have a longer introduction from the World Health Organization representative, Ms. Sarah Hess, discussing the question, the global challenge and their overall guidance to faith communities. Please.
Again, thank you so much for this opportunity to be here, to be a part of this panel and to be a part of this important conversation. It really is a privilege for me. I will give a brief update of the epidemiological situation, although I do think that with the huge amount of media coverage at the moment, there's probably very little that I can tell you on that front that you don't actually already know. I will go through some of the challenges that we are facing globally, and then on to some of the opportunities and areas of hope that you spoke about. So as everybody knows, a global pandemic, we are very quickly approaching 500,000 cases of COVID-19 globally in over 200 countries, areas and territories. And we can say that everyone everywhere is affected in some way. Even by the time between doing these slides and giving this presentation, the numbers are changing rapidly. We are now, I think, over 19,000 deaths, unfortunately, all over the world. The epicenter of the pandemic continues to be in Europe at the moment, with Europe contributing up to 75% of the daily cases globally. Previously, the region of Lombardia in Italy and Wuhan in China were the most badly affected regions. However, as we're seeing, things change on a daily basis, and certain areas such as the city of Madrid and the city of New York have are suddenly experiencing extreme rises in cases and rises in the number of deaths, unfortunately. So our Director General, Dr. Tedros, made a statement in one of his press briefings recently about how the pandemic is really accelerating From the identification of the first case, when it was reported to WHO, it took 67 days for us to reach our first 100,000 cases, 11 days to reach the second 100,000, and just 4 days to reach the third 100,000. And now we're quickly approaching 500,000. And so every day we see increases. In addition to the actual burden of the disease, we know that many regions of the world, whole cities, whole countries, have implemented restrictive measures and shut down multiple operations. And so we have billions of people around the world who are affected, who are staying at home. So not only is this a public health crisis, but it really is an economic crisis at the same time. So I'd like to go quickly through some of the challenges that we're facing. One of the main challenges is to do with the severity profile of COVID-19. Although we know that 80% of people who do get infected will either have mild or moderate disease, this is good news. It still means that 40% who get moderate disease will get pneumonia, and pneumonia is, in everyday terms, a pretty severe sickness. So what we're seeing here is that as the number of cases increase within populations, so do the number of cases who are critical and severe increase. And these are the patients that need hospitalization. So very quickly as cases increase, we enter a situation where health systems can be overburdened very rapidly. In addition, we're facing potentially a global shortage around protective equipment, as there is an increasing global demand. And because of the restrictions on travel and trade, we have insecure supply chains. And this means that we have health workers around the world who are risking their lives on a daily basis and who are potentially doing their work without the adequate protection. Another one of the challenges that we're facing is that we know that older people are more at risk of severe disease. So this graph here on the slide is the data that we have from the Republic of Korea that shows very clearly a gradual increase in severity and with the increase in age. And this data is very similar to the data that we have received from Italy and China. So older people represent a very vulnerable population, not only in the terms of severe disease, but also in terms of isolation. They, when they are isolated, they may not have access to basic supplies such as shopping and community as well. And so for us at WHO, this population represents a very vulnerable population. And of course, there are other vulnerable populations around the world, and these are the populations that are at risk of death. It's something that we grapple with a lot at WHO. We issue guidance and recommendations, and on a global scale, this guidance and recommendations make sense. But often when we try to translate them into different settings, we really struggle because we tell people to self-isolate when they are potentially infected. But what does this mean to a person who has an unsheltered homeless person? We say that the most effective preventive measure is to wash your hands with soap and water, but for many people around the world, access to clean water and soap is really not possible regularly, in addition to access to healthcare and a secure income. And so this represents a huge challenge globally. Another thing that, as I mentioned earlier, the economic crisis, we have just one example on the slide here. This is data that we have from colleagues at IATA who have done some sort of analysis of the economic impact of the pandemic on the travel sector. And you can see from their map that there are travel restrictions covering 98% of global passenger revenues around the world. And what this means for that sector is really a catastrophic financial impact, and not only on the sector itself, but on the individuals who are employed within that sector. We can see that air transport, as they say, is provides a total of 65.5 million jobs. And these jobs are at risk in many parts of the world. Not to mention, of course, that there are many people who are self-employed and many people in the informal work sector who will be suffering. Another major challenge that we're facing is the challenge on mental health. So not just the anxiety that goes around a new disease and something that is affecting us on a global scale, but also secondary challenges that arise when you enter situations of isolation and quarantine. We need to take careful consideration that for many people, the home is not a safe haven where you have cases of domestic violence and abuse. And we really regard this as a primary challenge for us to overcome. So we feel very privileged at WHO to begin to enter into a conversation and a relationship with faith communities around the world, because we do see the existing work that you do and the existing role that you play in the lives of millions of people as absolutely critical at the moment. I'd like to acknowledge first and foremost the role that many faith communities play in supporting local health systems through the delivery of care. And often this delivery of care is happening in very remote and under-resourced settings. Also, I think very important in terms of supporting the local health systems is really delivering correct messaging to the faith communities and adapting faith practices to reduce the risk of infection. And when people are informed, they are able to make right choices. And this, in terms of supporting the health system, mean that more people are at less risk. And so we really acknowledge that faith leaders are a trusted source of information, and therefore when they are providing the right information, it really is a supportive role to WHO. Another role is that faith communities are playing is the ability to harness social media and technology for good. So we hear a lot around the world about different religious gatherings being live streamed, WhatsApp chats with faith messaging. And this, I think, particularly for vulnerable populations and people in isolation, is a really critical area. In addition, looking after older people, mobilizing the community around them to deliver food and regularly check in. I know, at least from my personal experience in faith, that there were a lot of older people really dependent on their religious community and the gatherings, and so found a lot of not just mental but physical support in that area as well. And then again, looking after the vulnerable people, advocating for the rights of vulnerable populations such as refugees and migrants, and in these settings providing education and delivering care. And last but not least, of course, is standing up against the stigma that may come, and being really showcasing what caring communities can do. And I think this is already being done around the world, and I hope that within WHO we can really support showcasing that. Just from WHO's perspective, some of the opportunities that we'd like to take forward with the faith communities is really a continued and sustained collaboration. So we have access to the science and the information, and seeing ways that we can combine that with different faith communities, with the theology, and reaching wide sectors of the population. We do see COVID-19 representing a huge opportunity for increasing solidarity between people, and we know that faith communities are doing that already. Again, I mentioned the leveraging of technology. So when we talk about social distancing, it's not necessarily social distancing, but more physical, and we have a lot of technologies to support that at the moment. And then just sharing around the world, creating a community of practice within different faith communities. And I believe I have just one more slide, but it's more to show that some information resources that WHO has that are available, and I'd be happy to take questions, and I'm just really thrilled to be here today, so thank you.
Thank you. Thank you, Ms. Sarah Hess. I think this is a very good overview, but also a very strong message to us as faith communities that we really can make a difference in many ways. And I could like now to invite for 3 responses to your presentation from church leaders who have, in different ways in their constituencies, dealt with or are dealing with these challenges of accompanying congregations and people. And the first I would invite is Reverend Dr. Hyunju Bae, and we ask for a 4 minutes presentation from each one of you. Thank you.
Thank you for your invitation. The church in general, and especially the ecumenical constituencies in Korea, have been actively cooperating with the government and local governments and medical experts to respond to the pandemic and to prevent the spread from the initial stage of outbreak and to the present time of strongly recommended total shutdown. And the churches accompanying their congregations mostly through online worship, and they invite the congregations continuously to the regular weekly prayer, sometimes fasting prayer, and praying for the hardworking government officials and public healthcare officers and doctors and nurses and volunteers, and seeking the guidance of God for our nation and the entire human family in trouble. While big and mid-sized churches can afford to maintain the online worship on their own, the small-sized churches, both in the city and the rural areas, need help. So there is a clear role for the, the denominational center offices or the assembly headquarters to play. And some of them try to create an online platform for mutual exchange of new experience, the daily experiences of the local churches on the daily basis. And it is very crucial to maintain the sense of the church community as the one body of Christ at both local and national levels in this time of crisis. They try to respond to the financial crisis the local churches, especially small-sized churches, go through. And they continue to engage in diaconia ministry, the fundraising to donate the masks and the disinfectants to the vulnerable communities, especially the elderly and the children and the migrant workers and the communities of the disabled, and the many people who are living in the blind spot of social welfare system. And they try to communicate with the missionaries abroad, finding themselves in trouble. And the church in general is committed to convey this most update news and public guidelines coming from the governments and the WHO, usually through the websites so that the people they could visit and find the most crucial information easily. And this stresses the importance of relying on the trustworthy scientific, medical, and the official source of information, and try hard to warn against the danger of the fake news and the rise of xenophobia and the stigmatizing, as Sarah said before, the infected people. So this is a very brief summary of what the churches in Korea are doing.
Thank you for this very good update. I think we then ask our colleague, Dr. Mathews George, to present for us.
I represent a large constituency of churches in Asia, starting from Iran in West Asia to Japan in East Asia, and from the north from Nepal to New Zealand. And almost all countries in CCA's Christian Conference of Asia's constituencies, the churches and the people have been affected, and they are all struggling in various ways. At the same time, they are all trying to respond to the crisis situation and also working together with the different faith communities as well as with the governments and also with intergovernmental agencies. That is what we have been receiving reports on a day-to-day basis. Well, in most of the countries, the churches, they are located in remote areas, and in that way, they are not in a position to organize their worship services through online or anything. Still, they have decided to cancel the church services. As we all know that this is the Lent season, and most of the churches, they have regular church services, but at the same time, they are not in a position to participate or organize any church services. And also several of the Asian governments, they have introduced the strict policies. In that way, the countries are locked in, and in that kind of a situation, churches also have decided that not to be engaged in any church services. Even governments have introduced systems, and they have given strict warnings to church organizations and other religious groups not to participate not more than 10 members in a wedding service, or not more than 15 members in a funeral service. So the churches, at the same time, most of the places, the churches, they have already canceled the church services. There are no Sunday services or evening prayer meetings. Not even they are in a position to organize at homes. At the same time, churches in several Asian countries, they have already decided to extend cooperation to governments, and also they are working together with health workers. In India, 3 major health organizations working under the auspices of 3 different Christian bodies. One is the Roman Catholic Church, and also the Protestant and Orthodox and the Marthoma church groups, which is CMAI, and also the evangelical groups. All these 3 organizations mobilized all the Christian hospitals in India. 1,000 hospitals, they have offered spaces for treatment of the coronavirus affected people, and 60,000 beds they have already prepared for any kinds of eventuality. So this is the way that the churches are cooperating with the governments and the authorities at the local level and at the national level. Well, one of the most difficult problems these days people are facing, mainly the poor people from the local communities, because of this kind of self-isolation or the strict rules that was introduced by governments due to the emergency situations they have declared. They are not in a position to go out. They are not in a position to work, mainly the casual laborers, the poor people and the socially and economically backward communities. When they are suffering and struggling, of course, several churches, they have decided to support that kind of a group. So this is one of the noble way of demonstrating solidarity with the struggling and suffering communities by the churches in Asia.
Thank you. Thank you, Dr. Mathews. I think we move on to also Archbishop Job.
Yes, well, for the Orthodox Church, the coronavirus pandemic is a big challenge because the Orthodox Church defines herself as a worshiping community. Nevertheless, the Ecumenical Patriarchate of Constantinople, since the beginning of the pandemic, has issued 2 communiques in which it was stated to follow very closely the instructions given by the World Health Organization as well as the local governments. And therefore it was decided that the churches should be closed to public worship. The monastic communities continue to have their worship, but only for the community and not receiving visitors from the outside. In order to give the people the opportunity to follow church services, different parishes, monasteries, and even the Ecumenical Patriarchate itself from the Fanar broadcasts church services through the internet, which gives the opportunity to people to follow the worship from their home. But definitely the Ecumenical Patriarchate encourages the people to stay at home and in order to avoid physical contact. So this is a challenge. This is something unexpected, but we hope that through these measures we can save lives. And as the Ecumenical Patriarch has stated recently, it is not our faith that is being affected. It's the life of our neighbors that is being affected by the disease, and therefore the churches have to preserve lives in adapting good measures and attitude that is protecting the people from the virus.
Thank you very much, Archbishop Job. I think all these three presentations give us a very good picture and also very good examples of what our colleague from WHO actually have asked for from our churches and from faith communities. We now take a short break until we go into the second round. In this second round, we will actually start by asking our representative from the World Health Organization, Sarah Hess, can you say something about at what point should the gathering of worship services not be advisable? And how can these decisions be made? And we have heard some examples, but what are your general advices on this?
Thank you for the question. I think our advice is really that there is not a one-size-fits-all answer. So the decision about whether to cancel an event and to restrict gatherings really depends on the local context. So what that means is, at what stage is the outbreak in that country? Are you seeing a couple of scattered cases? Is there already community transmission going on? Obviously, if there is community transmission, then we would advise very strongly against large gatherings. The other context to consider is whether or not there are national restrictions in place. So we have heard previously of several examples where governments have implemented restrictions on gatherings, so where there is not more than 5 or 10 or even less. Having said all of that, taking the local context into consideration, we have seen countries in some countries in Africa, like Uganda, and who sort of went into these national shutdowns before even receiving their first case. So because the nature of COVID-19 is such that it moves very quickly and there are so many unknowns about it, countries are taking pretty big measures very early on in their outbreaks. What we do advise, though, at WHO is that we move away from the terminology of shutdown, because in a lot of settings, and it doesn't just apply to the faith community, but it also applies to schools and working, there is a huge amount of creativity going on in how we partially shut down. So do we telework? Do we teleschool? Do we do remote services for congregations? And to really ensure a continuity of all these different aspects. And once we do go back to holding religious gatherings and other gatherings, to just make sure that they are as safe as possible, so that all practices that are being observed in gatherings are done so through the lens of restricting or minimizing infection. So having said that, yeah, there's no one size fits all, but definitely we would err on the side of caution while maintaining really a strong continuity through other means and social technologies. Thank you.
Yeah, thank you. From the World Council of Churches, we have said in a couple of our statements that this is the time not to touch one another physically, but to touch one another's hearts by showing what we are not doing in the prevention and care for others. And I think that is also the message you give to us, that we do whatever is required from us, but also by our own initiative have a proactive approach to how to avoid transmission and how to prevent particularly the most vulnerable. Let us now listen to some inputs from our colleagues here. I would like to ask Dr. Olivia Wilkinson to also give us some examples of solidarity shown by faith communities displayed in this time of crisis.
Thank you very much, and thank you for the opportunity to present today. So we have been very lucky to come together with a variety of colleagues. We've got colleagues from Georgetown University and the Joint Learning Initiative, and my own organisation have been working on this platform. And what I want to start with is the platform is an opportunity to bring together a lot of different information on the roles in which religions around the world are playing in COVID-19 response. And the immediate thing that we have seen with this platform is such a large willingness and desire to share information, ideas, and encouragement. There's been really a very overwhelming response to people coming forward from all faiths and many different countries around the world to let us know about the ways in which the changes to their religious gatherings and practices are being reported, the guidance materials that they have available online, and where that can be found. And we've been able to bring that together somewhat, but what we've also seen is just a real openness for from a lot of different denominations and faiths to share their information, to help each other access the best quality information while we are still very much in what is probably the initial stages of our response. We have seen, for example, Facebook groups coming about that are a space for interfaith and interdenominational solidarity between clergy, for clergy to share ideas with each other, WhatsApp groups that are available for the same purpose. And all of this is building this idea of solidarity between religious leaders and communities. In a specific example that I'd like to bring forward, there has been support between faith communities in different countries. So we heard from a report this week from the China Committee on Religion and Peace, who sent a message of solidarity and support to Religions for Peace in Italy. Their full statement is available online, but I thought the one particular element that they brought out is an old proverb that they wanted to highlight to the group in Italy, which said, "We are waves of the same sea, leaves of the same tree, and flowers of the same garden." So we're seeing more and more opportunities for solidarity. Initially, as I said, it's been around information sharing, but the presence of Facebook groups and WhatsApp groups are also around the sharing of spiritual support and sustenance in this time between groups. And it must be a priority to continue this line of solidarity amongst faith groups as we go into the next few months. Thank you.
Thank you very much. I could like to come back to Dr. Mathews George and ask you about something you already touched, but I think we should go a bit more into it. How is this requirement of maintaining social distancing and promoting hand hygiene actually feasible in the context of people living in conditions of poverty and in communities that have very little facilities in this respect? Could you say something about that?
Well, this is one of the main challenges in several of the Asian countries where people, when we talk about hygienic situation or hygienic conditions, in fact, they are not in a position even to have any soaps or clean water, and also sanitators and face mask. So this is actually a real problem for many people in different Asian countries. At the same time, some of the churches, they have even started making face masks through the women's group in their churches, and they started distributing this to communities, not only for the church members, but irrespective of any religion or caste or creed. That is what is really happening. And also, as I mentioned earlier, some of these people, those who are really in a difficult situation, who cannot go out because of the restrictions, and those who cannot work, and they are struggling to have their basic needs of life. And of course, churches have come forward to organize a common kitchen, and also some of them have started distributing this to the people. And also governments have started in some areas where churches also are collaborating with them. This is what is happening in different Asian countries through the initiative of the local congregations of the churches.
Thank you, Dr. Mathews. I think we face an enormous challenge, but I'm also encouraged to hear that churches also think in a very practical way and not only think about the spiritual dimension in a narrow sense here. Archbishop Job, apart from the church services, what are the key aspects of church practices and tradition that also can assist us in this crisis, particularly also in this context of quarantine and isolation and the mental challenge we face, many of us, I mean, in different ways, having been isolated and facing a new way of life where you're not prepared for?
Yes, well, this crisis of the pandemic is happening, as it was said before, actually during the time when most of our churches are observing the period of the Great Lent, which prepares to the feast of Easter, of Pascha. Traditionally, the period of Great Lent was actually a period of self-isolation for prayer and a period for showing solidarity. So I think these two key aspects from the tradition are very helpful for us to live this very difficult period of self-isolation. First of all, if we are not able to attend church services physically in our communities, this doesn't mean that we cannot pray at home. And actually, through prayer at home, we are called to transform our homes into a little church. There is a very beautiful initiative that comes from the Holy Mountain, from Mount Athos, the monastic community of Mount Athos, which is the spiritual heart of the Orthodox Church. There is a call to all Christians to engage into a prayer chain by praying at 10 o'clock every evening, 10 o'clock according to our local time, which means that when we finish praying, somebody else starts praying in another part of the world, by repeating just a very small phrase, Lord Jesus Christ, Son of God, have mercy of your world. This is a very short prayer that everybody can do at home, praying for the salvation of the world. Another aspect besides prayer is, of course, solidarity. Wherever we are in the world, we must not forget the other people of our communities, especially the elderly, the people who are lonely, and we should manifest during this period our help, for example, helping them with grocery shopping, or bringing them food, bringing them their medication, whatever they need. So self-isolation through prayer does not mean that we should forget about our neighbors.
Thank you. I think rather the opposite. This is also the effect of prayer, that we are to see the other, not only ourselves. We have, as a World Council of Churches, daily prayers in the Ecumenical Chapel. When we were able to meet there, our colleague who prepared the prayers there have started a new practice, preparing prayers for us that we can pray in groups or by ourselves, and they are also now shared on internet every day. And for example, as a staff leadership group of the WCC, we pray them together every morning. And we realize that actually this is a time that brings us more together for prayer than before. So Ms. Ebun James, what are the lessons, both challenges and opportunities, that you can share from your Ebola crisis experience in your country? And what could you say also about communities that are confined for long periods? How can they deal with it?
Sierra Leone is the only country in West Africa that has not been affected by COVID-19. Our government has put in a series of measures that will kind of protect us. And as religious leaders, we from my experience from the Ebola virus, we are working diligently together, and I mean the Christians and the Muslim. We are working diligently. We take messages from the government to the people. We have messages of hope, try to put away stigma. Churches have been closed down, movements have been restricted, and it is when people hear this from their faith leaders that they know the significance and the importance, and they trust us with the message. Now, during the Ebola, some of the challenges that we got was getting the prevention and prevention messages to the people about Ebola, because at first the message was Ebola kills, and that's made people who were sick did not go to the hospital. Communities have to learn to live in a different way. Their freedom was restricted. Their social lives were disrupted. You know, in Africa, as is a communal living, there was also the issue of trust level between the politicians and the opposition leaders. So the church leaders had to come in and get the trusted message to the people. Because of the death toll in the homes, because schools were closed, at the end of Ebola, most of our girls became pregnant. You know, over 1,000 of them became pregnant, and then that added to the suffering and unwanted babies. And we also noticed that the gender-based violence increased in communities. But it provided us with opportunities for the Muslim and Christians to build up the existing trust that we have and to work together. For communities to organize themselves into action, action-oriented leadership abilities were valued. You know, now communities are protective. They want to know who come in, who is sick. For CCS said, it helped build our reputation as a service provider, because we did go out to communities and identify sick people, identify people that need support, and also we also talked about the safe and dignified burial. So before now, they were dumping people in mass graves, but as a religious community, we identify safe and dignified burial, and that helped us through the Ebola crisis.
Thank you. I think listening to you make us aware also of many dimensions of the seriousness of this crisis, both seriousness for each person, but also for the communities. But also, I think I listening to you, I also hear really signs of hope that communities affected also can really mean communities able to do something. And if we have the right approach, and also if we have also a sense of creativity in how we can support one another, it really can mean something. I think we all know how much it means that somebody contact us unexpectedly, but also from the perspective of just caring. So thank you, and I think also your practical advice at the end is very important. We have also to keep ways of showing dignity to each human being, whether they are living or they have passed away. This is also for the whole community very important. Thank you. I think we then make a short break before we go to the third round. In this last part of our conversation, I think we should go a bit deeper into what are really the challenges that the WHO sees with faith communities. I think that somebody told me that there is a shrinking window for faith communities to really avoid that they become hubs of transmission. And from what we have heard today, I think I'm encouraged to hear that a lot is done to avoid that, and to see that actually faith communities really are taking this seriously. But I'm afraid that not all of them are doing that. And therefore, we need also the WHO's support. What are your ideas regarding continued engagement, not only now in the beginning, but a continued engagement and sustained partnership with us as faith communities?
I'd humbly ask that faith communities continue all the good work that we've been hearing about on this call, all the engagement with their constituents, the solidarity, the sharing of practices, the working together across different faith groups. This is already happening, and it's inspiring to us. I think from WHO's perspective, what we do ask is that you help us to disseminate the information that we are putting out there, the advice on preventing infection, reducing transmission, addressing stigma, caring as well for vulnerable populations, making people aware of their risk. We have this information, and we rely on faith communities to disseminate it, but we also really would rely on you to fact check it for us in terms of how relevant it is for your practices and constituents. We want to be providing guidance that is implementable in different settings, and so we do ask going forward that we continue this collaboration in terms of you holding us accountable for the relevance and applicability of our guidance. We'd also, in addition to providing the information and the facts, we as WHO can play a convening role, and we offer to do that going forward within this within the area of work that I'm focused on at the moment, the Ebun network, which is the information network for epidemics. We hope to continue this network through COVID-19 and into the future, and we hold faith-based organizations and faith leaders as a core sector within that network. And so we look forward to continuing that collaboration going forward. And another way that WHO can support you is by really trying to amplify your messages of solidarity. And we see that coming across on many different channels, and we would be delighted to showcase that where we can and where possible. And so we look forward to working together on a more sustained basis beyond COVID. So thank you.
Thank you, Dr. Sarah Hess. I think this is a very strong admonition, a very strong encouragement also to take our own role very seriously, but also to believe that we really can make a difference. And I'm very grateful for the invitation for an ongoing mutual accountability between you and those we represent in different ways. I think we have to be also on a learning journey together. This is a beginning. It is not done by this. But I think also we see that among faith communities, there is a huge challenge to make faith faith community a community of truth, a community of caring based on truth. And therefore also I think your emphasis on that is more significant than we like to think. I mean, there are actually also among faith communities and others those who spread fake news on false information and also based on a religious furnace or conviction. And in this, I would like to ask also particularly Dr. Hyunju Bae, how can faith communities discourage this falsehood and fake news regarding the pandemic? What is your experience from that?
Well, I already shared the situation in Korea, that the churches stress the importance of relying on the trustworthy medical, scientific, and official source of information. And we need to continue to do this practice. And we also need to continue to emphasize the importance of discernment when it comes down to this area of falsehood and the fake news. But there are Christian churches that remain unclear about the relation between faith and science, and also church leaders who have not been benefited from the ecumenical theology serving for the common good of humanity, and remaining in a sectarian mindset. And this reality of many churches on the ground poses a real challenge in preventing some churches from falling trapped to falsehood and fake news. And I think this area is the place waiting for the long-term commitments, contributions from the ecumenical churches and Christians. And what matters most ultimately seems to be the importance of building the mutual understanding and trust building among the leaders of churches and the leaders of faith communities and civil societies and the mass media journalists and public health officers and the government officials. It is very crucial for the sake of effective communication and effective governance to gather collective wisdom and the overcome together this unprecedented crisis of COVID-19. Thank you.
Thank you. And I think your words here are very significant also, as you have gone through some real experience about this in your context, and how important it is actually also, as you say, that there is an accountable ecumenical fellowship that are accountable to truth and sharing the truth. Thank you. I think we also move on now to Dr. Katherine Marshall, asking you to reflect on the potential of stigma and discrimination against certain nationalities. We hear, for example, against Chinese, but also Italians. There is such examples. Please give us more information about this.
We often say that religious institutions and leaders can be part of the problem, but above all, part of the solution. And looking at the experience of the AIDS crisis and also of Ebola, we're well aware of the potential both to accentuate the problems of discrimination, but also to bring out the best in people and in communities. And I think the words that we've been hearing up until now about trust and dignity and also inclusion are absolutely critical. There are two narratives that we're hearing. One is that we're seeing a remarkable binding of the human family and an appreciation of our common interests, our common being, and our common challenges. And that is what is most heartening, is to see and to hear some of the stories of caring and so on. But we also are hearing signs of the reactions of fear, which come out in discrimination, increasing gun sales in the United States, even riots and anger at the prevention of gatherings. And this is where I think we count on a very broad leadership within communities, including the interfaith and the ecumenical, the interfaith, like the World Council of Churches. There is these two narratives. One is that we're going to see a much better world where people are aware of the environment, are aware of the common needs, and that the partisan divisions are divided. But from past pandemic experiences and crises, we also know that there's a real potential to see an aggravation of tensions and conflict. So I think that that is something that we need to be aware of, and we look to the leadership of religious institutions to steer us in the more positive direction. Just to add one comment, one of the themes here is that the faith communities are dealing with, as we all are, with uncertainties as to what's going to happen, changing messages that are happening as we go along. And we do need to look to the longer term, starting now, even in all this uncertainty, to rebuilding a better world, I think we would like to think. But in the meantime, we're talking about the need for very skilled translation. And this meeting is an example of that, between the worlds of religion and the worlds of development institutions, multilateral institutions, national institutions, need for trust. And it's a two-way street. In other words, the WHO and other institutions need to hear these voices, above all to help see where the vulnerabilities are and to identify those who are suffering. So that as programs are developed, the G20 is meeting today, virtually, the UN is meeting, G7, all of these bodies, the UN, the World Bank, the IMF, are all thinking about rescue packages, basically, that are unprecedented. And what we want to see is the religious voices at the tables where those are decided, because the focus needs to be on those who are most vulnerable.
Thank you. I think we see our role and also our mission in a new way through this huge changes and quick changes, but they refer us back to, as what we have said there, also to very basic dimensions of our faith, of basic care, of justice, of also keeping faith in a long-term perspective, not give up immediately, but also to see another horizon beyond what we are able to see today. So I think also, thank you for saying this, I think it's important that you have to say, sometimes we also have to be those who go beyond what politicians and governments are focusing on, and to help even to say the truth against them sometimes. But I'm convinced that also, as you say, this conversation among those examples of how we can develop this discourse in a very, I would say, in a faithful, but also in a truthful and also consistent way. We also want to ask Mrs. Ebun James, the General Secretary, how did you accompany the health workers in the Ebola crisis? They paid a very heavy price, and the situation is also applicable in this situation. And I think all of us know health workers, we have them in our families and others. We are concerned about them. How can we really support them, also as faith communities?
We did not have trained health workers, but what we did was we had to advocate for health workers, because we had incidents in which landlords will give them notice when they come back, because they were the front workers. And so there is this fear that they bring Ebola back to their neighborhood. So landlords give them notice. So we had to give them we have to advocate to government for them. Sometimes if the landlord is a Christian, the church leader or pastor will go and talk to the landlord. So we're also able to provide emotional and spiritual support to them, because we are short of nurses in Sierra Leone and doctors too, and they were dying. Some do not want to go back to the hospitals. There was no safety gear. They had their own family issues, and then there is a stigma of people running away from them. So one of the things we did as religious leaders was to advocate for better care, for more salary, and even for their salaries to be paid in time was an issue here in Sierra Leone. So we basically did advocate, and we provide emotional and spiritual support for them, and talk to communities to respect them and their work, and that helps.
Thank you. I think we should not underestimate this mental and spiritual support to people who have this kind of task, and also huge challenges in their own exercise of whether they are professional or not, but in the exercise of their care. One of the very encouraging new phenomena we have seen, for example, in some European countries, is that every evening there is a public applause outdoors for the health workers and their ongoing struggle for the people who need their help so desperately. But thank you. I think this is also a good sign of an example of what we as faith communities also really should care for. Archbishop Job, what are your reflections on how we have got to this situation of the pandemic? And what could be the way forward? I mean, if we look at this more in a longer perspective.
Well, I think the crisis of the pandemic that we are living now invites us to reflect about our relationship between human beings, our relationship with the creation, with the environment, and our relationship with God. I will try to explain this by sharing three main ideas. Well, first of all, when what I hear from the scientists, from the doctors, is that very often the diseases, the viruses that which challenges us recently, during the recent decades, very often the origin is linked when some animals are displaced from their natural environment and put in an artificial environment for the use or for some exploitation by human beings. So very often this is how these diseases appear. Secondly, we have seen how quickly this coronavirus has spread throughout the world. I think now it's almost, there's no place in the world which is not being affected. And of course, this is a consequence of our globalized world, where we travel very quickly all over the world, which means that we give the opportunity to such viruses to spread very, very quickly, not only within a region, but throughout the world. And thirdly, this crisis invites us to reflect, to observe the fact that a very small virus has in fact paralyzed the whole world. The activity of the whole world, the economy of the whole world, the well-being of the whole world. So until very recently, the human being was thinking that he was the master of the world, that everything was under control. And yet suddenly we see that a very small virus could change all our habits and could change the way of the life of the whole world. I am not a prophet to say what should be the next step, what we should do tomorrow once we get out of this pandemic, but definitely I see in this pandemic an occasion to reflect on this relationship between human beings, the creation and God, and perhaps to change our way of life. To change our way of life, this is the real meaning of what is meant by Christ in the gospel as repentance.
Yeah, thank you. I think we will in many ways be called to reflect on what does this mean, but also what can it mean in terms of changes to the better. I also have shared some of these reflections in different ways in messages from the WCC, that it can be really also a new understanding of how interdependent we are and how much it means that we actually care for one another. And actually we cannot survive as one humanity if we don't care for one another. We will be vulnerable, all of us. Nobody can really be without a close relationship, but also an international relationship where we really care for one another. And there is a challenge now that we fall back to nationalism, to protectionism, in a way that also can hurt the more vulnerable and also less privileged. But thank you, Archbishop Job. I think it's important that we also at the end here ask our good colleague, Dr. Mwai Makoka, to share some reflections about how do you now see also this as a challenge to the ecumenical movement and the potential of the ecumenical movement, and both our focus and competence in terms of health issues, but also how this is combined with the wider mandate we have to work for unity, for justice and peace in the world.
Thank you very much for all the good reflections. I think what is coming out clear from this conversation is that we have the immediate concerns, the short term, that we really have to get out of the pandemic as quickly as possible. And even as the pandemic is unfolding, we are already learning some key points which can help us to match and be able to get out of it faster now. Firstly, we are learning that actually we are not referring necessarily to social distancing, but physical distancing. And that underlines actually the aspect of maintaining the connectedness of the community, either at the working community or a worshiping community in churches, and even at home, maintaining the social networks. And we are also seeing lessons where risking an error on the side of caution is actually paying off in some countries that are able to act a little more faster. And we're also seeing that actually some public health measures need to be thought through a little more to see how they can be implemented on the ground. And we have several structures I think we should be called upon to support that type of interrogation. How can this be practically implemented in my community, in our communities? A little bit in the medium term, we are seeing that, I think Katherine mentioned very clearly that if anything positive can come out of this pandemic, it will not come out automatically. There has to be some active engagement. And several issues have been mentioned to point to that. We have issues of maintaining mutual accountability between faith communities, and also strongly between faith communities and World Health Organization and other government agencies. We are also seeing that actually health doesn't belong to the health sector only, and that health workers, the definition of health workers has to be quickly adjusted and expanded, and seeing how non-traditional health workers or people who are not trained in the health professionals can actually be much more instrumental on the ground to cover the last mile. So health work is not a monopoly of the health sector. Neither is it a monopoly of those that are trained in health sciences. We're also seeing actually how faith communities can help and are helping to translate science policy advice into practice at the ground. And there is the core of actually the reverse engagement, that as policies and guidelines are being made, there has to be deliberate engagement to make sure that beforehand, those are already informed so that they will be applicable. And also that those that will be at risk of being left behind are already taken care of, are already considered. So those policies, when they come out, they should at least not marginalize many people. The economic incentives that some countries are promising, we can already see that those that are not in the informal sector will be left out. And there has to be that advocacy and engagement already to ensure that those who have are going to be left out, at least they should not suffer as much strain. I think those are some of the key points that I can pick from the conversation.
Thank you, Mwai. Mrs. Sarah Hess, would you like to have a final comment from your side, from what you have got out of this today?
I think Mwai was very clearly articulated the main points. I just think that what I've taken away is that we really all in our respective roles and communities can be amplifiers of what is good. And like you said, what is true, and for us, WHO, the science, and just, yes, again, joining in how Katherine put it, the global family, each really stepping up to the roles that we have and doing it with compassion and with care. So thank you.
Thank you. We have come to the end of our conversation, and I really want to thank you all for this very fruitful and also very mindful sharing of practices, good practices, but also of understanding of the challenges, and also particularly also to encourage faith communities to stand up and to be also empowered to see what we can do in many ways and be courageous in doing it. I think there is from a church perspective, there is a strong pastoral dimension to this. How do we care for people, but also how do we help them to see a wider picture that also can keep us going by faith and hope and love. And there is a kind of prophetic dimension to this of speaking up, speaking against what is wrong, speaking up against what is fake and misuse of power in this situation, but also really a role of being practical. I mean, faith always should lead to something practical, because life is practical. We are human beings, and we are human beings together. We have a need, and we share the needs, and we share also the way to deal with the needs. When we face this pandemic, when we face also the huge challenges for the governments, but also the international organizations to give guidance, to help the world population to deal with it, I think it is also our duty and also our pleasure to say to those who work in the WHO, those who work in national health organizations and institutions, you are in our prayers, in our thoughts. We support you. We ask God to give you wisdom, strength, and also to give you the resilience you need to stand in this and go on day by day, and help us also to see how we can support you after this. Thank you.